doing the Facebook loading bar.
Yep, we see it.
Oh, I see it live on Facebook. That's so cool. Too bad you can't. Can you go live on multiple platforms at the same time? That would be cool.
I see us. We're
You
good.
see it on live? Perfect.
Yep.
Okay. So I'm going to go ahead and share my screen. And then present. Okay. Can you see the PowerPoint?
Yep.
Mm-hmm.
Okay, thank you all for being here today. This is part of the Made to Save, the Vaccinate All 58 Week of Action, and this is our Native Community Town Hall. My name is Wyatt Kelly. I have a Bachelor of Arts in Ethnic Studies in English, and I am Apache from White River on my mom's side, and I'm the Public Health Coordinator at the California Consortium for Urban Indian Health. And today I'm joined by Virginia and Dr. David Lowe, and if you guys want to introduce yourselves.
Sure. Ayi Queen, Naknau, Virginia Hedrick, Shregon Mewamechek. Good afternoon. My name is Virginia Hedrick. I'm a member of the Yurok tribe and the Executive Director for the California Consortium for Urban Indian Health. And so grateful, Dr. Lowe, for you to make time for us this evening. For anyone joining on Facebook, feel free to comment and ask questions, and we're checking there too. Dr. Lowe.
Thanks very much for inviting me to join you all. I'm David Lowe. I'm a professor of biomedical sciences at the UC Riverside School of Medicine, and I'm the principal investigator and co-director of the Center for Health Disparities Research at UCR, and also the Senior Associate Dean for Research in the School of Medicine. And so I've had opportunities to present information and updates on the COVID pandemic, the vaccination, and a lot of the community guidelines as we open up.
Thank you.
So just a background for those who are new to CCUIH, we are a 501c3 nonprofit here in California. We're a statewide alliance of 10 Indian Health Service contracted urban Indian organizations in California's largest cities. This includes direct medical facilities, medical, behavioral, and dental health, 2 outreach and referral facilities, and 2 residential treatment facilities, including an 80-bed facility in San Francisco and a 16 all-male facility in Manteca. We were established in 2006 and are just really honored to be doing this work during what will end up being a really interesting time in our history as we work through the pandemic. And we know that so many of our community members have been impacted by COVID-19. And I think we all have a lot of questions about where we go from here and how we continue to move forward. What real threats are there? What perceived threats are there? And we hope to be able to just work through some of that today. And again, thanks.
So a little bit about the Vaccinate All 58 Made to Save campaign. So I just want to talk about our partnership with the California Department of Public Health and Made to Save. So we partnered with the California Department of Public Health in this campaign, and it's a month of action where we're sharing things like this, town halls, events where community members can come and learn about the vaccine, about what's next, and how to move forward. And then Made to Save is a national educational and grassroots campaign, and they help bring awareness to the huge state campaign, Vaccinate All 58. So our goal today is just to kind of increase the awareness and knowledge surrounding COVID-19 vaccines, prevention methods and measures, and available resources. So Vaccinate All 58 was a campaign launched by Governor Newsom earlier this year for a safe, fair, and equitable vaccine for all 58 counties in the state. And Made to Save has launched the month of action, which is this month, to bring awareness to events like our town hall that's taking place. And all these events are taking place all throughout California. So a little bit about our partnership with the California Department of Public Health. So we partnered with the California Department of Public Health to develop public health messages on COVID-19 safety and prevention measures. We're also developing culturally adapted educational outreach materials, such as posters and pamphlets that will be sent to UIHPs, which are urban Indian health programs all throughout California. And then we're also developing online materials such as social media toolkits that are hosted on our website, CCUIH.org. I've also listed a resource that we just launched called the Red Line, Cal Hope Red Line. And this red line is a number and a text where you can call anytime if you have questions or concerns about the vaccine. Maybe you don't know where to get the vaccine in your area. You can simply call or text us, and our team will help you navigate all of those things. Virginia, do you have anything else to add about the Red Line?
Yeah, so the Red Line is available 5 days a week at this point, 7 a.m. to 7 p.m. All of our navigators have been trained in really a wide array of topics. So a person should feel comfortable calling for any number of reasons. If you're just feeling overwhelmed and distressed by so many of the added stressors that the pandemic has brought on, and you want somebody a safe and confidential space to vent that or talk through that, please reach out to the Red Line. Our navigators are also trained in suicide awareness. And so if you're feeling unsafe in your own thoughts and you need to reach out, that's another space. If you simply don't know how to access resources, if you're experiencing any kind of food insecurities, that being you just don't have enough food in your home for your household members, if you're having a hard time looking for jobs or navigating the distance learning environment with any children in the home, we encourage you to reach out. If you're looking for a place to find the vaccine and you're not sure about the process and you just want to talk that through with somebody, maybe you're feeling some anxiety about getting a shot in and of itself. We know that that's a very real reality that many people are experiencing. Really, the line is open for a number of reasons, and I just want people to feel free to give us a call, shoot us a text. If you want to just check out the website first, it's here, CCUIH.org/redline, and you can find out more resources. If you don't need access to the line, but you think that there may be friends or community members around you who could benefit from our Red Line, please share the information with them. Sometimes it's easy to try it out yourself, and then you can recommend it to others. So just wanted to share this resource that's available really for anyone. It's highly focused on American Indians and Alaska Natives here in the state of California. And so just thank you, Wyatt, for giving the background, and just wanted to just plug it a little more.
Thank you. So now I'm going to turn it over to Dr. Lowe to basically walk us through breaking down the vaccine, a vaccine info session. So Dr. Lowe, take it away.
Okay, thanks, Wyatt. So I'm hoping that this will help clarify a little bit about how the vaccines work and why they're important in protecting us from all these various infectious diseases, and in particular, how they're applied to protecting us from COVID-19. So to give you a more general background, to give you a context for how the vaccines work, on the left here, you can see that all of your cells have some of these essential components. The DNA, that's your genome that encodes the genes that basically provide function for your cells in life and so on. And then the RNA, which is the next step, where the genetic code gives rise to production of these messenger molecules. And these messenger molecules are then used in these little cellular factories to produce the next step, which is the proteins. And the proteins are the actual machinery that actually does the work of your cells and so on. And so infectious diseases such as viruses and bacteria and things like that actually all use the same basic principles. There's a genome that encodes these. There's an RNA message that then goes to these little factories that produce the proteins that do the actual work. And so for a virus to cause an infection, it relies on the same basic cellular components for that virus to infect a cell and then reproduce itself and cause the diseases that we have concerns about. Now, so then what is a vaccine supposed to do? So the vaccines basically are trying to target these molecules, like these protein molecules that actually do the job of the virus that cause the infectious diseases. And the way they target it is that your body, your immune system, produces antibodies. You can see that green Y-shaped molecule. And these antibodies have binding sites and actually bind to the proteins of the viruses and inactivate them and prevent them from working. So in your body, you want to have antibodies circulating in your bloodstream that can basically protect you from the virus that may get into your body by having these antibodies bind to those proteins on the surface of the virus particles and essentially inactivate the virus and prevent it from infecting your cells and doing all the damage it tries to do in trying to, reproduce and then infect the next person. Can you go to the next slide? So the goal of the vaccine then is to take these same principles and regardless of how we get there, try to develop your body's immune system to have the antibodies to then block that virus infection. So there are a handful of different types of vaccines that are in development, and some have already been given emergency use authorization, but they all kind of have the same business end. And so I'll start sort of from the right and move to the left. So you can see that string of pearls is the protein molecule. And some vaccines basically are produced by manufacturing these proteins. And so the Novavax vaccine, which is still in development, is basically a synthesized protein that resembles the virus proteins that are used to function. And those are simply injected to induce an immune response and the antibodies that can block the infection. Just to the left of it is the Pfizer and Moderna vaccines, which are two-shot vaccines, and there's synthetic RNAs that are replacements of those messengers that are used by the virus to produce the proteins that they use. However, because it's just a message, it doesn't have any infectious virus itself. It just has the signal message for manufacturing the protein. And so when it's used in your vaccine, it takes advantage of the machinery in your own cells to produce the protein, and then your immune response then responds with the antibodies against that protein. And then far to the left is the engineered viruses. So the Johnson & Johnson and Oxford AstraZeneca vaccines are basically engineered synthetic viruses that has its own genome that doesn't cause disease, but does have a SNP in there that does have the coding for the message and the protein of the COVID-19 virus, so that when these engineered viruses are injected into you, they again take advantage of your cellular machinery to produce the message, produce the protein, and then induce the antibody response in your immune system. So they all have the same business end, which is the protein, and how they get there may be direct or indirect, but they all do the same thing. They produce that virus protein, and your immune response produces those green antibody molecules that can bind to the protein, inactivate it, and protect you from infection. Okay, next. So, as I said, because they all rely on the same business end, which is that protein, the question is, does it really matter which vaccine you get? So a couple of things to keep in mind. Every vaccine, not just the COVID vaccines, but the flu vaccines, hepatitis vaccines, every vaccine that you get is extensively tested for safety before they're allowed to get any kind of approval by the FDA. And all vaccines have similar side effects. They can have some soreness at the injection site. And some people, because the immune response is getting ramped up because of that vaccine, you can get a little bit tired, headache, chills, and fever. But they're relatively short-lived because what you're getting is basically a pretend infection. Your immune response thinks something's going on, but you're not getting an actual infection by the virus that causes disease. So the immune system is just responding to these proteins and producing antibody responses without giving you the disease. And in essence, that's what a vaccine does, is it activates the immune system thinking you got infected without actually making you infected. Now, are the vaccines different from each other? Now, it's really been difficult to compare them directly because they've all been tested at different times, at different situations. But ultimately, the main outcome that's important for the testing of the vaccines is, does it protect you from infection? Does it protect you from severe disease, hospitalization, and death? And by those criteria, all of the vaccines that have been in use right now have essentially the same level of protection, essentially 100% protection from death, nearly the same level of protection from severe disease and hospitalization, as well as what we can talk about later, as well as preventing you from spreading the virus to any of your neighbors. So by that criteria, it doesn't matter which of these vaccines you get, because they all have similar degrees of effectiveness in terms of protecting you from infection and protecting you from severe disease. One difference may be important to you, that the Johnson & Johnson vaccine only requires a single shot, whereas the others require 2 shots. And, you know, you have to think about scheduling and getting you there for the second shot and things like that. So the J&J engineered virus really saved you that trouble. There has been discussion as some of these new variants come out, and there's some concern about that. So far, the evidence has been that all of the vaccines out there have similar degrees of protection against even the variants. And what's concerning about the variants is the fact that they seem to be more effective at spreading from one person to another. So that's really an issue for people who have not been vaccinated. People who are not protected and not vaccinated, these new variants prove to be more efficient at spreading within communities of unvaccinated people. So obviously the preference is that once you get your vaccine, that's no longer a concern. Next. So now the question is, once you've been vaccinated, what does that mean for you? I know that there's a variety of confusing information that's out there, especially because of concerns about whether there, you know, the various government or other kinds of medical recommendations say, oh, that doesn't change your behavior or anything like that. So what does it mean? In essence, to your own body, what really matters is that the vaccination produces antibodies in your system that's circulating in your bloodstream, and they'll block or reduce virus infection. So that means that if anybody exposes you or tries to, not on purpose, but if you get exposed that may potentially be able to infect you with virus, those antibodies will reduce the infection or block the infection entirely. And so that vaccine-induced protection means that even if you do get exposed to the virus and it starts trying to infect you, you get mild or minimal symptoms, and you're highly unlikely to need hospitalization, and you're pretty much 100% protected from severe disease or death. And also, quite importantly, is that because you have antibodies circulating in your body, that it means that it blocks the virus. And so it also means that you're pretty much unable to even spread virus to any of your neighbors, family, or anybody else. Next. So here's where it can get, I know it can get confusing to people because you're hearing different sources telling you slightly different things. So the science says, and as already pointed out, that the protection that it provides you from the after vaccination essentially means that you can basically go pretty much anywhere and not have to worry about infection. Now, the CDC is trying to be a little bit more specific, and they say, well, okay, now you can be indoors with fully vaccinated people, such as your family or whoever, colleagues, without having to wear a mask. And that's still providing a little bit of protection, just in case somebody is immunocompromised or susceptible or something like that. So you're still looking out for your neighbors and family and trying to protect them. You can also be indoors with unvaccinated people. Because you've been vaccinated, you're unlikely to spread it. However, again, to protect your friends and neighbors, if somebody that you're indoors with has some susceptibility, say they're a cancer patient or an immunocompromised or other kinds of chronic disease, you want to reduce any potential for infecting them. So it might be in those particular cases, you might want to be prudent and at least wear a mask just to prevent the possible spread to them. Now, the other point is that if you have that protection from vaccination, it means that if somebody is near you who has COVID-19, you don't have to worry. You don't have to go quarantine yourself for a couple of weeks or anything like that because you're essentially protected. You do want to keep track of whether or not you do develop any symptoms, although it is really highly unlikely that to happen. Okay, next. So the kind of precautions mainly have to do with masking, although as with most infectious diseases, we always encourage people to use normal sanitation procedures like in washing your hands and so on. And that's a conventional way in which you can prevent any kind of disease spread. And just to give you an idea of how effective it's been, this season when we've been protecting ourselves from COVID-19, we would normally expect to be having a raging flu influenza season as well. You know, of course, we encourage people to get their flu vaccine every year. Yet, because of the protections that people have been doing in terms of staying indoors and wearing masks and things like that, we've actually had no flu season this year at all. There have been 0 flu deaths, even though on a normal year, we can get between 30,000 and 80,000 deaths in this country from influenza. And we've had basically 0 because we've had almost no flu season at all. Just to tell you how effective these kinds of sanitation methods can be in protecting us from other diseases as well. So honestly, I'm probably going to wear a mask every flu season as long as we're getting used to it.
Yeah, I really wanted to throw this slide in there and just stress the importance of hand washing and continuing to sanitize their hands, because I know we've heard in Indian country and in the community that people are saying, yeah, I'm out, you know, grocery shopping and I'm out doing this. And I'm noticing like not a lot of people are cleaning their hands as much. As things are starting to open up, people are just like forgetting that they should be constantly cleaning their hands and washing their hands. And I think that is, you know, one of the main factors as to spreading disease is with your hands and everything you touch. And, you know, traveling starting to open up. We have powwows that are going to start happening in person, and we have ceremonies that are happening in person. So I just, you know, want to put it out there to remember to keep washing your hands and keep sanitizing, keep a bottle on you at all times.
And to reinforce the idea that, you know, of course, we want everybody to get vaccinated, and these sanitation measures don't, you know, just because you're vaccinated doesn't mean you can ignore them, because you're still interested in protecting your friends and neighbors. So by washing your hands, you also decrease the risk of transmitting any disease, infectious disease you may pick up on your hands and transmitting it to somebody else. Okay. So
before we move on to masking, Dr. Lowe, I wanted to pitch some questions to you that we get really frequently about the vaccines. Okay. I think Wyatt's skipping ahead for us, but so if you could address a couple of questions just from your perspective that I think we're seeing a lot of, from my perspective, misinformation on, and I think they're all kind of related. So potential negative impacts to pregnant women or breastfeeding women, impacts to the woman and to their unborn child, concerns around fertility and how the vaccines may, well, there's just misinformation that the vaccines will cause a woman to become infertile. And this is, I think there's a heightened sense of awareness of this in Indian country now that the vaccines have been made available to 12 to 15. So our younger girls who are, you know, still in a developing stage. So I'm wondering if you could address those two, And then recently it's been brought to my attention that there's some concerns around shedding for those who have been vaccinated. In fact, I've seen some campaigns around unvaccinated people saying they don't feel safe around vaccinated people. And I want to recognize I'm adding a little bit of, I think, frustration from my own perspective on this. And I try to remain really objective and neutral, but it's kind of wearing on me at this point. And I just wanted to pitch those to you and see, if you could just help explain. I don't know, I'll just pass it to you.
Yeah, this is really important because there are two things I want to say. That there are some situations where there's occasional side effects that are of some concern and people are studying them. But at the same time, there are people who are intentionally making up stories that have absolutely no basis in fact and are only intended to feed on people's fears. And so we want to distinguish between those two. So just to give you an overall picture of this, there have been hundreds of millions of doses administered, and nobody's died from that. Just to be clear, nobody has died from the vaccine injection. Now, there is a concern because in some places, there's been a low incidence of people with allergic reactions to the vaccine, and they've been treated with, like those EpiPens, and they've been able to recover. We don't know why some people are potentially allergic, but it's an extremely rare incidence. There have been a handful of cases where people did have some kind of bleeding problems soon after vaccination with some of the engineered virus vaccines. And again, it's not clear why that was happening, and that's being studied. The interesting, well, not interesting, the concern about these kinds of rare side effects is that they're often in the range of 1 in a million or less. Now, the reason that can be of some concern and some alarm is because some of these side effects actually occur in regular people 1 in a million times, even if they never got the vaccine. So just because you have this chance occurrence of the vaccination and this rare medical event, doesn't mean one caused the other, or were they accidental coincidences. And that's why there is such very careful monitoring by the FDA and CDC to make sure that if you see these rare, serious medical events, people are studying to see, are they statistical flukes that they happen, or are there actual direct causal relationships? So I will say that, this one concern about this clotting, not a bleeding disorder, but a clotting problem in a small number of cases is being studied on whether or not the engineered virus has some role to play in that. And that we don't have the final word on that question. Now, I do want to say then the other side of it is that there are people intentionally spreading crazy rumors just to feed on people's fears. So, there are the stories about, interaction with the 5G network, or that now you're magnetized and your key will stick to your skin and things like that. Now, honestly, many of your keys are not magnetic anyway, so that's clearly just a magic trick people are playing on you. And so this concern about fertility and bleeding actually are entirely fabricated, entirely made up stories. There is absolutely no evidence for any incidence of these kinds of effects. There are concerns about fertility and babies and things like that. What we do know is that if you're pregnant and you get an actual COVID infection, there is serious risk of harm to the fetus, to the unborn baby. So if you're concerned about risk, you are best off getting actual vaccines, because the consequences of getting the actual infection are far, far worse than any potential side effects of getting the vaccination. Now, there are clinical studies ongoing now with pregnant women, and as far as I've heard, we haven't seen any evidence that it has any side effects. So as I said, it's much worse risk to go unvaccinated and risk getting the infection and causing harm to the baby. The other question you were asking, and this is really important. So as I mentioned, the different ways the vaccines were generated. The only thing, as I said, is the business end is the protein that is part of the virus that is used to activate antibody responses and protective immune responses. That protein is not the virus. That protein is also not infectious. So having the vaccine means that you only have the component to trigger the immune response and none of the other components that are part of the actual COVID-19 virus itself. So there's no actual components that are infectious or can produce disease, which means when you get the vaccine injected into you, you have nothing in you that can produce virus or can lead to any shedding of active infectious virus. So it's important to make that distinction that there is no risk of shedding virus because you don't have any of those components in your body from the vaccination. Hopefully I was able to make that clear.
That was really helpful. Thank you so much.
So masks, this is the most recent issue. As I said, I'm likely to be wearing masks next flu season, but this is where it's confusing, where honestly, I think part of the confusion is that we benefit from the fact that we have had the vaccines that are effective and safe faster than any previous time in history. And I know people are concerned about that, and I should probably speak to that as well, is because people are saying, oh, I'm not going to get the vaccine until we've had more experience. It's like, just to point out, we've had hundreds of millions of doses and people have not died from the vaccine. So we have pretty good confidence that it's safe. So no reason to not get vaccinated. But what does this mean in terms of masking? As I already pointed out, that now that you're protected, you can be with other vaccinated or even unvaccinated people without risk of fear of getting infected and transmitting disease. But now the question is, do you wear a mask? As I said, for people, if you're near people who are susceptible, vulnerable, like cancer patients and things like that, you might still want to be prudent and try to protect them. But there is a little bit of mixed messaging in terms of whether or not you should be wearing a mask. The problem is that our medical advances have gotten a little bit ahead of the government policies. And so while the CDC says you're protected and you don't need to be wearing a mask under these various kinds of conditions and things like that, then you go downtown or to the mall or whatever it may be, and you see restaurants saying no entry without a mask, or stores saying that, and so on. And we work at a university where we're also bound by the Cal OSHA guidelines, and they still haven't modified them to say, oh, if you're vaccinated, you're safe. They basically say under all these conditions, they expect masking and distancing. And those guidelines are potentially going to be in effect for quite some time. What do we do? The governor wants the state to be fully open by June 15th, but if the on the books regulations haven't caught up to that, what do we do? So I would say that from the point of view of your own health and safety, number one, get vaccinated. The masking is where, be patient, the government policies, the stores and all that may catch up soon enough. If you having a concern, it doesn't hurt to wear a mask, but know that if you're vaccinated, whether you have a mask or not, especially if you're outdoors, you really don't have to worry about catching the virus or anything like that. And Tony Fauci will say, well, if you're outdoors, you're distance from people and there's a lot better air circulation, you also don't need a mask. So yes, masks have a useful purpose, especially in protecting your friends and neighbors. Um, if you don't feel shamed about wearing the mask or anything like that, no harm. It can help remind people about the that we are still in the pandemic. But as I highlighted at the top of the slide, California has the lowest rate of infection and transmission in the country. And so, masking is would be nice, but it's really not as high an issue. And I would get in trouble, but I'm not a government official, so I can probably get away with it. I think we're in a very good situation as long as we are attentive to the question is like, let's make sure that we don't set up conditions where people aren't getting vaccinated and there is still a susceptible population that can still get infected and still transmit it, especially people who are susceptible. The way I describe it is this, is that as anybody in California is familiar with wildfires, and just because we don't have wildfires going right now doesn't mean we're not vulnerable. We have very dry drought conditions and the low humidity and moisture in the plants and so on. It's like saying if we have a large population that's unvaccinated, all it takes is a spark and that'll explode. So again, my priority is to tell people get vaccinated. That's far more important than these other questions about masking and things like that. I think the confusion is there, and as things are going to try and settle out and catch up to each other, as the stores and restaurants start to figure out which guidelines they're going to be following. June 15th comes along and the governor says, look, everybody open, that's great. But remember those wildfires and make sure you get yourself vaccinated.
Do you think you could speak to this question I have, Dr. Lowe? So as things are opening up and they're saying you don't have to wear your mask in places like that, I find that maybe it's an excuse for some people who never really wanted to get the vaccine or wear the mask in the first place to just go out in public, not being vaccinated and still being out there as if they have the vaccine. What do you think about, that type of thing?
Well, I suppose if they also want to drive around without putting on their seatbelt, that's on them. I think for your own personal safety and security, I'm just going to be concerned that I'm protected and vaccinated. If I'm not the boss of them, so I'm not, if they want to take on that risk, as much as you may want to tell them you should be doing that and so on, people may be going around without masks and things like that. That is definitely a concern, as I said, because, like I said, comparing it to the wildfire situation, I think that's a risk they're taking on themselves. And as long as you are getting yourself vaccinated, I would be much less concerned.
Thank you.
Dr. Lowe, I really hear that on this. Like, I feel like the entire pandemic has really been about risk management and personal decisions around the types of risks we're willing to take or not take and what makes sense for, families. For example, in my local school district, children had an option to return to school or stay in a distance learning model. And I have 4 elementary aged kids. They each had about 5 to 10 students in their classrooms that were deemed cohort C and stayed online. And that's, part of, families and individuals making those risk assessments. I think what I'm hearing you say is for those who have not been vaccinated, it's really going to be about their risk mitigation strategies and how they decide to move about. I think something that, and then I also heard you say that for vaccinated individuals, we're learning more and more, but there's a growing body of evidence that would suggest that vaccinated individuals are not very good carriers of COVID and are not good at shedding the virus, even if we do get a breakthrough case, which is something we see similar in children, right? Children who get COVID often have really low viral loads and end up not being great vectors. Even when they test positive, we're not seeing children spread the virus in the same way that we see adults in their contact tracing so easily spread the virus. So I think that's in my mind, and I see you nodding your head, but that's also how you're seeing it. Like vaccinated individuals, even if they are in the rare case, someone who gets a breakthrough case, they're just not going to be a good vector for spreading.
Yeah, and I want to reinforce a few things. One is that even, there are people who say, well, I've been infected, so I don't need it, right? Well, actually, there's evidence that having been infected doesn't give you the same kind of long-term protection as being actually vaccinated. So we're still recommending that even if you feel you've been infected, you should still get the vaccine because you want longer-term protection. You don't want to get reinfected. And we know that people who have been infected, a significant number of those people go on to have long-term problems, vascular problems, mental, cognitive difficulties, also, some of the, other kinds of problems. And we're still learning about that because, honestly, the disease hasn't been around us more than a year or so. Well, okay, now a year and a half, but that's really, we're still learning about that. And you're probably better off not being one of the people we're going to learn about from the long-term consequences of infection. But the other thing, again, I want to emphasize is that, even if you're saying, oh, I don't care if I get infected and things like that, it's really about protecting your friends and family. If you care about your community, if you care about your friends, your family, and your community, that being vaccinated is a way of protecting your community. And I think, to me, that's as important as anything else.
I agree. There's some other things that I hope we see cultural, and cultural, I mean like in the United States or even in California, cultural shifts that I hope we see change. For example, I think our workplaces have always celebrated employees who come to work even if they're sick. Like they're such a hard worker, they still show up even on their sickest days. And that is in so many cases celebrated. And it's like kudos to the person who's sniffling through it. And I think I'm hoping that post-pandemic we will all have a deeper understanding of how important it is to stay home if you're sick, really vaccinated or not vaccinated. If you're not feeling well, stay home. And that is an act of love for your community. That's an act of love for those around you. And it should not be regarded as a selfish act. It should not be regarded as, not being tough enough, but really, I am going to do what's best for my neighbors, for my community, for my elders, to stay home if I'm not feeling well and to get tested, right? Like we are seeing testing rates go down, and that's natural because so many more people are vaccinated. Our contact exposures, contact tracing, I think they're all taking a deep breath, I hope. But I think it is still important that so many of our Indian health programs have testing available to go ahead and get tested. If you're not feeling well, it's easy. It's 10, 15 minutes, get the test and rule out a virus that has had devastating impacts to Indian country. And so we've been trying to think about what are those safety protocols moving forward around hand washing, staying home if you're not well. But I think what I really appreciate about what you have shared is being vaccinated should really be and is our first strongest layer of defense. It's the thing that scientifically has been proven to be the most effective.
Yeah, and I completely agree with everything you said here, and I think I don't. It's funny. I'm thinking I should point out that the one thing I didn't say, now I'm going to force myself to say, is that I didn't talk about herd immunity. I want people to get away from obsessing about this question. You can still protect your community, your friends and neighbors. You can still protect yourself just by getting vaccinated and not worrying about, oh, have we reached that threshold or anything like that. Don't, that's not, it's not worth going into that. By people being protected, we can't be lulled into thinking that if the infection rate is low, that we're safe. Because I said it's more important that the infection rate is low because we're vaccinated. Because if the infection rate is low and we're all susceptible, vulnerable, then again, it's back to the wildfire spark thing. So that is the only context in which I was going to mention that.
Well, you're lucky it wasn't on my list of questions. Have we reached herd immunity? The magic question. And for me, like just from like an indigenous cultural perspective, that piece of like, we all have a responsibility to each other, and absolutely like that herd protection, the idea of it. But in some ways, for me, it feels a bit selfish that somebody would say, I'm not going to get the vaccine because I'll let everybody else do it. And it's like, well, you have to like be a pillar here too. We all have to be in this together if it's going to work.
Mm-hmm.
I wanted to look, I know we had a few folks join us in the Zoom. We haven't had any, we've had some comments in agreement of some of the things that have been said so far, but no direct questions on the Facebook Live. But I know we do have a few folks joining us here in the Zoom room, and definitely not calling anyone out. But if anyone has a question and they want to pitch it, please, like, it's not a speak now, forever hold your peace, because you can stalk us on social media and you can ask us there, and we'll ping it back to Dr. Lowe, or we'll do our best to answer it. But just, I want to thank those who took time to join us tonight and offer a space to ask questions.
Hey, Henry.
Yeah, I think maybe you've covered it already, but I was interested in hearing about women who are thinking of getting pregnant. And I was speaking yesterday to a lady at a retired teachers meeting, and she said that her daughter-in-law does not want to be vaccinated because she had heard of some kind of risk to, I guess, the unborn child or something, if from the vaccine. I assume, we didn't talk about it because it didn't seem like a very good thing to bring up with the other retired teachers at the table. But
well,
anyway.
as I said, there are active clinical trials being done with pregnant women, and well, our daughter-in-law delivered our second grandchild during the pandemic, so we were happy that there was no infection or anything to worry about. But the vaccine has had no known effects on pregnant women. But as I said, there's well-established negative consequences if you're infected while you're pregnant. So far better to get vaccinated either before or while you're pregnant and protect you and the baby than think, because as I said, many of these kinds of rumors are, like I said, some of them are troubling, now you're magnetized and all that sort of thing. But these are easily spread because these are legitimate fears that people have. It's just that the stories are spread to feed on that rather than relying on actual reality or facts. And that's unfortunate because people often don't know where the most reliable sources are. And having these kinds of town halls are important because you often, don't get your medical advice from Twitter, right? or Facebook, because too often it's being intentionally used to spread a lot of bad information.
And when I've been asked this, because I realize we all value choice. And despite like public health knowledge and what we know to be fact, that there's this value in America that we hold around choice. And so I have shared with women who are pregnant or planning on becoming pregnant, from my perspective, you really have two choices. You can get the vaccine and feel protected by that and actually be protected by it, or you can continue a shelter in place environment. Like if I were pregnant, I would perceive those as my two choices: one, to be vaccinated, or two, continue to be in a shelter in place environment, which means you don't have a baby shower, which means you're limiting the guests that are in your home, which means I'm still doing grocery delivery. I'm not going, out and about, because I understand the high risk situation I would be in if I were pregnant and to contract COVID-19, particularly a woman of color, particularly an American Indian woman, all of those risk factors. And so I think that's something I also share with community is you don't want to keep layering risk factors. The fact is that American Indian women have poorer birth outcomes than non-Hispanic white women. Black women have poorer birth outcomes than non-Hispanic white women. And so we have to know, like, what is my risk category already? And then if I layered COVID-19 on top of that, what does that look like? So I can get the vaccine, or I can continue to, what also works is just stay home, right? Stay home, don't see people, continue with extreme social distancing, which is hard to give that recommendation because we know how isolating that is. We know the deep mental health impacts of that. I think as Indigenous people, we're also understanding the deep spiritual impacts of how much we are craving and longing to be in our ceremonial spaces together. And so for me, if it were me, and it's not me, if it were me, that shelter in place environment would not be a viable option to me. The first option would be to be vaccinated and to know that I'm protected in that way. So I share that for those who might be listening about if you want options, those are your options. You can be vaccinated, or you can continue with what most people are not going to do. Most people, we are living the vaccinated lifestyle, and we're returning somewhat to normal and sending our kids back to school and going into the workplace and making the play dates and going to Disneyland and traveling and being around friends and family again. Would not be an option for someone who I think is not a viable option for someone who is vulnerable.
So to go along that, I mean, I'm a biologist and immunologist, and so it's kind of sobering to think that the reason we have these pandemics is because they take advantage of our social practices, that they are able to spread because communities, so of course I come from a background where handshaking is not as common, in Asian cultures. But when direct contact and close quarters and things like that are what holds societies together, those are also the things that help these infectious diseases spread. And so to say, oh, well, we want to protect them from diseases and everybody needs to be isolated, things like that. Well, what is the consequence to society when you have to change that kind of behavior? We want to kind of find ways where we can provide at least some degree of protection from the spread of diseases, or at least have a communication network saying, this is coming down, change your behavior for the couple of weeks, let it go, let it not infect us, and then we can return to our usual practices. I mean, this is certainly in underserved communities where it's like, oh, are they out to get us? It's easy to feel that way because, again, these pandemics really exploit our social behavior.
Mm-hmm. Do you have any more questions from the audience or on Facebook? I just want to share real quick. Thank you all for being here. I know it's dinner time for most people, so it's tough in these Zoom meetings in the evening, but I wanted to put this survey link up here. It's an interest survey that we're doing, and the purpose of the survey is to assess the needs of our Alaska Native and American Indian communities through California. It takes about 5 minutes, and it kind of just gives us a good idea of what our communities need all throughout California.
Thank you, Wyatt. And I want to thank you again, Dr. Lowe, for joining us, and James and everyone else that took the time to spend the hour with us. So much appreciated. Those watching on Facebook know that CCUIH is always one quick message away. Please do the survey link. And just another plug for our Red Line. I know some of our Red Line team are on. Hi, Ben, I see you there. But our Red Line navigators are always ensuring that they're up to date with the latest, and happy to have a conversation with anybody who is looking to just chat it out. So thanks everyone again.
Thank you so much.
Thank you.